Welcome and good morning, and thank you for joining us on this momentous day. I am John Tomkowiak, the founding dean of the Elson S. Floyd College of Medicine, and it's my pleasure to welcome you to the Elson S. Floyd College of Medicine Commencement Ceremony to celebrate the class of 2021. To all of our graduating students, their family and friends, and all of our guests who are joining us, including WSU leaders, legislators, advisors, faculty, staff, community members, and others who have supported the College of Medicine, thank you. Today, 121 students are graduating from our 3 programs. These graduates include 55 doctoral students, 38 master students, and 28 baccalaureate students receiving their degrees. As a new College of Medicine, we have spent the last few years celebrating our many firsts along the way. Today marks the culmination of many of those firsts. Not only is our first class of medical students graduating, but this is the first College of Medicine commencement ceremony in which all of our amazing medicine, nutrition and exercise physiology, and speech and hearing science students will graduate as one unified college. It is truly an honor to share in this first with all of you today. I would now like to introduce Dr. Kirk Schultz, President of Washington State University.
Congratulations to all of you graduating in medicine, nutrition and exercise physiology, and speech and hearing sciences. The entire Washington State University community is so proud of you and your commitment to addressing the health and well-being of our rural and underserved communities across the state and beyond. You've worked hard and successfully navigated a challenging journey, including a global pandemic, to reach this historic day. You undoubtedly will look back at this moment as one of the major accomplishments in your life. Today is a particularly historic day for the university and the Elson S. Floyd College of Medicine. For the first time in our institution's 131-year history, we are conferring medical degrees, another step in our land-grant mission dedicated to serving the needs of the people. What a day it is, the culmination of a dream envisioned by the late WSU President Elson S. Floyd. Congratulations, College of Medicine graduates, for serving as the trailblazers and face of WSU's newest health initiative. As all of you move forward in advancing your careers, you will be the guardians of the lives of some of society's most vulnerable. Remember that our communities need you in the dark places and in the quiet places. They need you where no one else is listening and where others may not see. Don't forget those who struggle because they lack resources and opportunities. Think of those with limited access to the kind of education you received and the innovations you have been part of. You are prepared not only with the knowledge to prevent, care for, and treat diseases, but also to fight injustice and poverty. Remember that poor and sick not only deserve your empathy, they deserve your respect. Through your efforts, you can lift up all of us, bring us together, and restore our trust in relationships that bind us rather than those that divide us. We are excited to watch as you make our world a better place. Go Cougs.
Thank you, President Schultz. I would now like to introduce Dr. Daryl DeWald, Vice President and Chancellor of WSU Health Sciences.
Today, we're honoring the first medical graduates in WSU's history. Getting to this point took many people, communities, partnerships, and so much work. Former President Elson S. Floyd was undeterred in his vision that Washington State University would launch a community-based medical school in Spokane. And President Schultz has escalated that vision. We know that vision could only have come to fruition with the aid of the greater Spokane business community and many advocates across the state of Washington. Notably, none of this would have been possible without the foresight of our legislative leaders who over the past decade worked to make this day a reality. Here in Spokane, we are so appreciative of the massive efforts of champions like Senators Andy Billig, Jeff Holy, and Mike Baumgardner, and Representatives Marcus Riccelli and Tim Ormsby. But we had incredible support across the state too. Marcus' efforts, combined with other leaders, facilitated support from more than 2/3 of the entire House of Representatives from the state of Washington to sign on to the bill authorizing the medical school in 2015. Senators Mark Chancellor, Sharon Brown, and Judy Warnick, and Representatives Sharon Wiley, Drew McEwen, and Mike Sells brought critical support from Ritzville, the Tri-Cities, Moses Lake, Vancouver, Union, Everett, and so many places across the state. Former Representatives Eric Pettigrew and Gail Tarleton were staunch supporters in Seattle who were hugely committed to enhancing healthcare in underserved communities. From the farthest reaches of eastern Washington all the way to the coast, our legislators made this happen. This support has afforded the opportunity for our federal delegation to engage and help build out our research and our graduate medical education programs. Senators Patty Murray and Maria Cantwell, and Representatives Kathy McMorris Rogers and Dan Newhouse have been great champions. To all the champions of the WSU Elson S. Floyd College of Medicine, we extend our heartfelt gratitude. So, for all the College of Medicine graduates, you should be proud of what you've accomplished. Recognize your accomplishment and the investment and support provided by your friends, your family, your community, and the state of Washington. I can't wait to see you in communities across the state working to create a healthier Washington. Thank you, and go Cougs!
Thank you, Dr. DeWald. Our College of Medicine bears the name of a man who had an incredible vision for what medical education and healthcare could one day be in the state of Washington. Dr. Elson S. Floyd lived his motto of being bold, audacious, and visionary, and inspired us all to live this way as well. Today, as we celebrate these talented graduates who will be the torchbearers of his legacy, we see the proof of his bold, audacious, and visionary approach to addressing healthcare challenges across the state.
I have never met such a visionary, effective, passionate professional as Elson Floyd. He has the ability somehow to channel vision and passion to execution.
I have never seen him back away from a great idea. He was the first person who said, we should do $1 billion.
He never had a doubt.
This legislation authorizes Washington State University to offer and teach medicine. And
he was always there to say, you know, we'll get there. This is the right thing to do. Let's just work our way through it.
He had the gift of making our dreams seem possible and turning our aspirations into reality.
There are now young people who have opportunities that they would have never had before if it hadn't been for Elson Floyd's leadership. What he did changed lives.
Together, Washingtonians are inspired and will carry on his legacy.
We are extremely thankful for the visionary leadership of Dr. Elson Floyd. He has become the voice for higher education in our state.
Good morning. Wow. This is so surreal. I cannot believe today is graduation day at Washington State University, Elson S. Floyd College of Medicine. How wonderful. Congratulations. I'm excited to be with you, and thank you for sharing in this opportunity to be a part of your celebration. Today, Washington State University celebrates the contribution to the global medical community. That celebration starts with this graduation exercise. You know, we're really proud of you. And I am really proud to be a part of and to be able to observe the festivities. To the graduates of nutrition and exercise physiology, speech and hearing sciences, and medicine, congratulations. So I asked myself, why are we celebrating and why are we so proud of you and happy for you? And I asked myself, why would Elson Floyd be celebrating today? He loved graduations, by the way. The answer, quite frankly, is he believed that all of you individually and collectively will accomplish greatness. Today is proof of that. You have successfully completed your course of study. You have worked in the greater Spokane medical community, and you are fully prepared to meet the medical challenges facing today's complex medical society. We are proud of the commitments you have made and kept by successfully completing this phase of your education and your training. I know you have accomplished this greatness with support, with great support, counsel, and love from so many people. I want to personally thank you for all you have done to accomplish your goals. I would also like to thank several others who supported you on this journey. I would also hope that you will take the time in the very near future to also thank your supporting cast. I would like to express my gratitude to your families who have been with you and lifting you up when your heart, your soul, and your mind were all telling you, I'm tired and I can't go on. I want to thank President Schultz and Chancellor DeWall for understanding how important you and your program in the health sciences is to Washington State University. I want to thank them for their support and their guidance to each of your colleges, the faculty, the staff, and the staff members. Because without all of those individuals, there would be no health sciences at Washington State University. And I hope you will take the time to thank them all too. Also, I would like to give a special thanks to the founding dean, Dr. John Tomkowiak, the faculty and the staff of the Washington State University Elson S. Floyd College of Medicine. I am most thankful for your commitment, support, and the diligence you have displayed to the College of Medicine. 4 years ago, at the white coat ceremony, I said this would be the greatest class. I was right. I truly still believe that today. Because you are the first, because the Washington State University faculty, staff, and administrators so clearly understand the standards that have to be exceeded beyond all expectations. And they also understand accreditation processes. You got the very best training as doctors and medical professionals on this planet. I want to thank all of you as students in nutrition and exercise physiology, speech and hearing sciences, and medicine. As graduates, I want to thank you for recognizing the privilege you have had to be educated in your medical field, and the privilege given to you to have the opportunity to serve our society. I know you will serve with great compassion and love for people. You will give them your best medical care. Congratulations for achieving this major accomplishment that you have spent your entire adulthood working towards. You deserve to be celebrated, and we stand proud of you, and we celebrate you. Please take the time to be proud of yourself and celebrate yourself. As I said, this is pretty surreal. Elson Floyd often said, and I quote, Because of your education and work at Washington State University, society will be better as a consequence of your work. Today's Washington State University commencement is the beginning of your medical career. Congratulations and go Cougs!
Thank you for your heartfelt remarks, Mrs. Floyd. On April 1st, 2015, this next speaker signed into law the authorization for WSU to create the Elson S. Floyd College of Medicine. That moment, alongside Dr. Elson S. Floyd, was a historic milestone that has enabled us to be here today. I now introduce to you Governor Jay Inslee.
Hi everyone, Governor Jay Inslee here, and I am really excited to get to address you. The first ever graduating class of the Elson S. Floyd College of Medicine. Congratulations. Trudy and I would like to extend our best wishes as you enter your residency program. We both love what you are going to do for our state and our community. She's a Cougar, I'm a Husky, and we know you're going to treat both with equal skill during your careers. And I have to tell you on a personal note, as a friend and admirer of Elson Floyd, to see his leadership be channeled to your careers is just very gratifying to me. What he did was remarkable for our state, and now you're going to follow that up, I'm sure. We are profoundly excited for your future, because your future is our state's future. We look in part to you as we aim to increase access to health care in rural and urban underserved environments. And for years, we've watched our physician workforce erode in these areas. This has produced great inequities in healthcare outcomes across our state. Elson had a vision for something different. He knew that we needed to change our inputs in order to produce new outputs. He knew we needed to grow our own physician workforce with Washingtonians who would train right here in Washington. Fortunately for us, you answered the clarion call. From across to Washington you came, from Covington to Colville, Woodway to Wenatchee, and Auburn to Albion, and so many other locales in between. And you've had the opportunity to train in clinical settings all over Washington, in many cases in the very region where you grew up. So from day one, you've been different in a good way, demonstrating an aptitude for public service and committed to improving the health of all of our communities. Some of you have military service in your background. Many others have already worked in healthcare. A great many of you have put yourselves out on the front line already as volunteers. These are the service above self intangibles we're looking for as we replenish and build our physician workforce. And as the last year has shown, your state needs you now more than ever. Your future challenges and your future colleagues are going to be practicing physicians and nurses and medical assistants and everyone else who are joining you and giving their all during the pandemic, and they need reinforcements. You are obviously the next generation of healthcare heroes, and we're so thankful you have enlisted. You've represented the culmination of a lengthy campaign to build this new medical school to try and correct our state's healthcare deficiencies. Congratulations to Washington State University and to the broader Spokane community that has worked tirelessly for years to see this day. It is a remarkable accomplishment. And to our graduates, please know how proud we are of you. And as you go forth in the upcoming days, I hope you'll start your work for health in Washington by making sure you spread your information about the COVID vaccine. We need you right now to share information so that people will be more confident to get this vaccine. We all know what the science is, and if you will share that in the upcoming weeks, you have tremendous credibility now, and you can move the needle starting today. So don't hide your light under a bushel. Tell people what you know and what you believe. Congratulations, more than ever, go Cougs.
Thank you, Governor Inslee. Our next speaker has been a champion of the College of Medicine from the beginning, spearheading the successful Leaders for a WSU Medical School effort to change the state charter so WSU could teach medicine. Today, she now serves as the Vice Chair of the WSU Board of Regents. I introduce to you Marty Dickinson.
Hello and congratulations. I first want to thank each one of you for taking a leap of faith and joining the WSU Elson S. Floyd College of Medicine 4 years ago. You not only believed in a mission and in a vision and in the purpose, you made it a reality. Many years ago, this notion of a WSU medical school was just a dream. Today, seeing what you have all accomplished is truly inspiring, and it is so gratifying to be someone that was a part of this and to see what you have been able to do and make possible. I am so humbled and so honored to be one of the many community leaders and a WSU regent that gets to say, congrats, you did it. You are part of a core that is going to be transformative with a force and a ripple that will change people's lives. So now, please go out, be a part of your community, share your humanity, share your caring hearts, share your knowledge, and go heal others. And remember, you are forever a Coug. Congratulations.
Thank you, Regent Dickinson. This next speaker has been a visionary in the city of Spokane for decades, serving 21 years as CEO of Greater Spokane Incorporated, where he and other community members championed the creation of the College of Medicine. I introduce to you Rich Hadley.
On behalf of the community, it is my honor to congratulate the WSU graduates in nutrition and exercise physiology, in speech and hearing sciences, and in medicine. You have been on a journey to get to this point and worked really hard, and you should feel awesome. And we do too. We have been on a journey as well. The business and civic leadership of this community saw a vision for a health science campus, including a medical school. And our graduates today are the first class of that medical school, the Elson S. Floyd Medical School. And I was in the audience during your white coat ceremony. It was thrilling, and it symbolized the journey that you have been on. Ours led to changing the Constitution to allow for a second medical school, getting operational funding, and then a building. And along that way, we met many challenges. And one of them was a snowstorm when we took 100 leaders to Olympia to advocate for a medical school. The blizzard in Olympia canceled almost all appointments. But our meeting with Governor Gregoire at her mansion happened. And she said, you know, I knew all these appointments might go away except one. And that was Spokane, because they're committed. And we were. We were committed to accomplish a medical school for Spokane on a vibrant health science campus. And you have been committed to reach this point in your studies and going forward in your career. So congratulations, and go Cougs.
Thank you, Mr. Hadley. I would now like to welcome our student speakers. Tina Dobrowski from Nutrition and Exercise Physiology, Kyle Geiger from Medicine, and Melissa Linus from Speech and Hearing Sciences to say a few words.
Good morning, graduates, families, and faculty. We did it. I congratulate and applaud all of us for making it through. The road has been bumpy and filled with pandemic potholes, but we made it. The impact of the COVID pandemic cannot be understated, but the flexibility of my peers, the creativity of our professors, faculty, and staff have provided us with a unique opportunity to stride into a new normal. We are the healthcare professionals of the future, removing the confines of four walls and opening the doors to see our patients from anywhere through the power of technology. We have been empowered by our education to help and heal our patients, engaged with technology in new ways throughout this year of distance learning and online practice. Now it is our time to take these lessons, these challenges, and create something bold and new, to reach for more and improve not only our lives, but those we interact with every day. Use the trials of the last year to inspire those around us, that any challenge can be overcome, and everyone can make a difference in the health of the human community. To my fellow NEP peers, I urge you not to forget the struggle of the first semester. Do not forget the elation of seeing a passing score on the exit exam. And do not forget the time we studied and struggled together. We are forever a global WSU support system. Lean on your peers when the load feels too heavy, and we will lift you up. I want to give a special thank you to the professors, student coordinators, preceptors, and my fellow graduates of the NEP department. Each of you has made this an incredible, impactful, and the most inspirational and galvanizing experience. Today, I celebrate you, and I say thank you. Congratulations, class of 2021. We did it.
Guinea pigs, trailblazers, risk takers, loyal Washingtonians, bold, audacious, innovative, and visionary. These were words we heard on repeat for 4 years. On a journey that started the day of the solar eclipse, we ferociously took notes on dermatoheliosis and the ever-elusive pancake syndrome. However, just like the eclipse, that journey was over before we knew it. Our eclipse viewing glasses have been replaced by safety goggles and N95s. Our wonder for the intricacies of medication mechanisms has been replaced by a feeling of nausea from memories of hours of board studying. Our hospital badges are worn, our favorite pen has been stolen, and our anatomy coloring books with one page filled out have been donated. The only constant we have faced is our own determination to see this through. At times, the difficulties seem to stack up, like the 174 histology lecture slides and a 50-minute time cap. This has left us wondering, what if, or did I make the right choice? Today is here to tell you, you did. In the last 4 years, we have done a lot. We've cared for patients. We've asked, listened, taught, and coached. We've intubated, sutured, pushed, and prescribed. We delivered babies and news, both good and bad. We started local and nationwide programs, dozens of student clubs, invested in next generation medicine technology. We published and presented life-changing research. In this same time, some of us became husbands, wives, moms, and dads. All our husbands, wives, moms, and dads never stopped cheering us on. We will forever be asked what it was like to be in the first class. There are many ways to answer this question. I hope that we all leave here saying there are only 55 other people in the world that can tell you, and every one of them would say, what an experience it was. Congratulations to the Elson S. Floyd College of Medicine, class of 2021.
Greetings and congratulations, Washington State University Speech and Hearing Sciences class of 2021. We made it. Despite all the unique challenges of the last year, we all finished school. We are one resilient group of students. I want to take a moment to recognize the incredible people who made this possible for us. First, I want to thank our personal support networks, our families and friends who cheered us on throughout this process. Next, I want to thank the faculty who tackled the challenging transition to online learning and managed to make our classes engaging and interactive over Zoom. I also want to thank the many community partners who provided us with valuable clinical experience through practicum and internship placements. And I specifically want to thank Karen Simpson, who spent countless hours orchestrating those arrangements. Last, I want to thank our amazing clients who showed us grace as we learned the ins and outs of providing speech therapy in a global pandemic. Thank you for continuing to come and see us every week, whether it be in person behind a barrier and a face shield, or through teletherapy over a computer screen. Thank you all for your support, guidance, patience, and flexibility. None of us would be here today without you. As we go our separate ways and take our next steps towards continuing our educations or beginning our careers, let us strive to embody the values we were taught in this program. Let us be compassionate and knowledgeable clinicians who provide evidence-based treatment, who incorporate the client's values, and who provide counseling to help our clients and their families navigate the emotional hardships of their communication disorders. Although it is easy to get caught up in the routine of work, always remember, you are changing lives. Everyone deserves a voice. It is our job to empower those we serve to find their voice. Few things are more sacred than the ability to communicate. Our duty as speech-language pathologists cannot be taken lightly. Congratulations, WSU Speech and Hearing Sciences Class of 2021. Let us go change the world through communication, one person at a time.
Thank you, students. It is now my distinct honor to introduce to you our 2021 commencement speaker, Dr. Beshara Shukair, a family physician by training, was appointed under the Biden administration as the White House COVID-19 vaccinations coordinator, where he focuses on coordinating the timely, safe, and equitable delivery of COVID-19 vaccinations for the U.S. population. A lifelong advocate for social health, Dr. Shukair has served in a variety of leadership roles during his career to advance health care for all, including Senior Vice President and Chief Health Officer at Kaiser Permanente, Commissioner of the Chicago Department of Public Health, and as Senior Vice President of Safety Net and Community Health at Trinity Health. He has been named by Modern Healthcare as one of the most 50 influential healthcare executives in the U.S., one of the most influential people in healthcare, and as one of the top 25 innovators in healthcare. And now, without further ado, Dr. Beshara Shukair.
Thank you, Dr. Tom Kowiak. What an honor to be invited to provide remarks at your graduation. It's quite humbling and a little intimidating. Every graduation is so special. It's a special moment for you, graduates, for your spouses, your partners, your family members. It is also a special moment for your professors and teachers and all those who supported you all through the years to get to this moment. You are graduating in the midst of a global pandemic, which made the completion of your training especially challenging this past year. There's much to be said about the unique timing of entering a healthcare profession and the passion and the perseverance it takes to be a healthcare professional in a time like this. So thank you. Over 3.2 million people have lost their lives around the globe. 575,000 lost their lives here in the United States. Think about that for a moment. It is a sobering reminder of how fragile life is. Every one of those 3.2 million people has a story. Every one of those 3.2 million people has hopes and aspirations. Every one of them is a father, a mother, a brother, a sister, an aunt, an uncle, a daughter, a son, a friend, a neighbor, and a loved one. Let's have a moment of silence to reflect on their lives. Thanks to the incredible work of scientists, researchers, doctors, trial participants, vaccine developers, healthcare workers, public health champions, and all of us, we have the privilege in this country to be able to get vaccinated so we can put this pandemic behind us. We all have a role to play to make sure that we do just that. Let's put this pandemic behind us. And this starts with all of us getting vaccinated. We have made a big progress in this country. We have administered more than 250 million doses of vaccines so far. More than 150 million people have received at least one dose. And more than 105 million people are fully vaccinated. And not that I'm counting, but that's 11 people getting fully vaccinated every single second since January 20th. I am so proud of how this country came together over the last 100 days. People 65 and older accounted for more than 80% of the deaths due to COVID-19. Today, 83% of people 65 and older have received at least one dose of the vaccine, and 70% are fully vaccinated. As a result, we have seen 80% reduction in deaths and 70% reduction in hospitalizations for this age group. Every time we have more vaccinations, we have less cases, less hospitalizations, and less deaths. That means we have more hugs, more safe gatherings, and more dinners together. And yet, we still have a lot more to do. So my first ask for you today, if you haven't gotten vaccinated, get vaccinated. It's never been easier to getting vaccinated. Get vaccinated for you, for your loved ones, for your neighbors, for your family. Get vaccinated for your community. And once you do that, I'm challenging you to find 10 unvaccinated people and make sure they get vaccinated. If they need help getting an appointment or getting to an appointment, please help them. If they have questions, please answer those questions for them. People want to hear from people they trust about the vaccine. And I have no doubt that so many people trust you. So please, let's help putting this pandemic behind us. So that was my ask number one, more to come. Now, we all know that this pandemic has disproportionately impacted our Black and Brown communities across the country. If you didn't have a stable roof over your head, the pandemic has impacted you even more. If you didn't have enough food at your dinner table, the pandemic has impacted you even more. And if you are working full-time and you still couldn't pay your bill, the pandemic has impacted you even more. I know we all want to make a difference. Otherwise, you wouldn't have chosen a career in the healthcare field, and you wouldn't have chosen the Elson S. Floyd College of Medicine. Many people expect you to solve for these problems. And honestly, it's not fair to expect doctors and nutritionists and speech therapists to overcome these challenges on their own, one patient at a time. The truth is, people may spend a few hours with a healthcare professional each year, but we spend a lifetime in our communities. And an unhealthy community cannot be expected to support thriving people. We all recognize that prescribing insulin to someone without a refrigerator isn't enough. We know that you cannot possibly take your medications with a meal if you haven't eaten in days. And you won't be able to even buy your medicine if you can't afford it. The solutions to all these social challenges in our communities are much bigger than any one of us can prescribe. We know all of this because we know the individuals whose basic human needs are not being met. We know their faces, we've held their kids, and we've been entrusted with their stories. And when someone shares that much with us, it's our privilege to be let in, and it's our obligation to reach out to do something about it. And frankly, none of us can do it alone because it's all connected. We're all connected. Soon after I immigrated to the United States in 1997, I started training to become a family physician at Baylor College of Medicine in a program that was focused on caring for people living in poverty, people facing homelessness, and many of my patients were immigrants. That's actually where I met Dr. Farian Williams, by the way. My first job as a practicing physician was in Rockford, Illinois, as the medical director of the Healthcare for the Homeless program. There, I met a woman. Let's call her Judy. Judy was charming. She was engaging. She always had a story to tell. She was in her mid-30s. She asked me to be her doctor. She had some aches and pains, minor infections here and there, and some obvious symptoms of her years of substance use. As I got to know her more, it became clear that her challenges ran deeper. Her mental health issues got in the way of her holding down a job. Her chronic unemployment made it impossible for her to get the care she needed. This one afternoon, Judy showed up in the clinic as a walk-in. As usual, I was ready to discuss her health issues with her: anxiety, depression, addiction. Then she told me what she was really worried about that day: finding a place to sleep on those frigid winter nights in Illinois and whether or not she'd freeze to death. These weren't symptoms they covered in medical school. The help she needed wasn't going to come from the walls of my clinic. I had already been working with social services agencies to try to connect folks like Judy with resources, but it never felt like enough. Each time Judy left, we both knew there was a chance she wouldn't come back. And one day, I got a word that someone had died from hypothermia in a park near the clinic. And when I learned it was Judy, it broke my heart. Her death had been preventable, but prevention was out of my reach. I felt I had failed her. Our systems have failed her. Our community have failed her. I couldn't write a prescription to treat homelessness. Helping the Judys of the world would require broadening my practice from individuals to communities. We have to support entire populations, the systems that impact them, and the places in which they live. I expanded my focus from patients to policies, from office hours to organizational impact. And I began looking for partners in my new practice, recognizing that no doctor could do it alone. And here comes my second ask of you today. Your patients will tell you about their challenges. You will ask about their needs. You will dig to find answers. I have no doubt that you will go above and beyond to be there for your patients. I know you will think about more than their body. I know you will think about their communities. To heal communities, we will have to work more collaboratively to pull the levers of influence, to shift public policy, to flex economic muscle, and to create communities that propel people forward, not hold them back. I don't think it's a fantasy. You have an opportunity to build a more thoughtful, complete approach to health. So today, it's no longer a question of if the healthcare field is going beyond the four walls of the clinic. It's a matter of how we're going to do it and how big we're willing to challenge ourselves. The time for patience, my friends, has long passed. If we are going to succeed, it is time to get impatient. The more we push forward and the deeper we dig for solutions, we will encounter barriers, big ones. The painful symptoms of unhealthy communities are intrinsically tied to larger systems that have been around for generations, designed to raise some people up while holding others down. It is hard to live in a country where you can see people sleeping on the streets, not getting enough food, and dying from gunshots. But that was my childhood in Lebanon. That's not the America I imagined as a child. A lot of things surprised me when I immigrated to the United States, and I learned to adapt. It started with food. My very first breakfast in the United States after a very long flight from Beirut was grits and bacon in Charleston, South Carolina. My first thought was, what are grits? And I soon discovered the joy of other American surprises like peanut butter and jelly sandwiches, a seemingly really strange combination that I quickly fell in love with, but I still can't explain to my mom back home. I got more used to this American experience. I soon went on to work with homeless patients in Houston, tried to house seniors in Chicago, and attempted to get more mammogram screenings into some zip codes. And I often felt helpless. How could a country with the best doctors, the best science, and the best technology in the world be leaving so many people behind? A lot of things surprised me about America, but nothing shocked me more than how deeply systemic structures of racism and inequity ran through communities, and how firmly they stand in the way of health. This isn't the sort of thing we're supposed to just get used to, ever. It can all feel overwhelming, I know. However, I challenge us to work even harder by taking on the very systems that enable inequities, and we're often built to do so intentionally. Take tobacco as an example. As a country, we've passed life-saving indoor air laws, put our muscle behind tobacco prevention, and raised the minimum age of tobacco sales to 21 across the country. The FDA is even now considering taking menthol cigarettes out of the market. Still, tobacco use is a major contributor to the 3 leading causes of death among Black people. Even though they usually smoke fewer cigarettes and start smoking later in life, Black people are more likely to die from smoking-related diseases than their white counterparts. And smoking is at least 40% higher in the nation's LGBTQ+ communities. None of this is a coincidence. Take healthcare disparities as another example. We are all working on eliminating racial disparities in care, like cancer screenings. Yet in America, colorectal cancer death rates are 52% higher in Black men and 41% higher in Black women compared to their white Americans. That's no coincidence either. Since 2016, immigrant women are experiencing premature births due to stress. And when 1 in 4 children living in the United States have at least one immigrant parent, how do we expect them to focus in school when they're not sure who's still going to be there when they get home? That is no coincidence either. I won't pretend that we have all the answers, but I believe they're in this virtual room. The status quo isn't going to change itself. Nothing will ever get done if we never get started. Housing costs, food insecurity, and social isolation, firearm injury, climate change, and economic inequality, racism, homophobia, and immigrations. These issues are big and complicated, and that's why I encourage you to take them on. You know, I'm often reminded of the wise words in Arabic that my grandmother shared with me when I was in medical school. And she told me, كل إنسان عنده قصة، وإذا بتتسمع لقصص الناس رح تكون أحلى حكيم بالدنيا. Everyone has a story, and if you listen to people's stories, you will be the best doctor in the world. So I'm hopeful as you get ready to move to the next stage in your life that you will take a moment to listen to people's stories. And that is my third and last ask of you today. Listen to people's stories. Everyone has a story to tell. I feel so privileged when someone decides to share their story with me. It's an honor, it's a responsibility, and I learn to take those stories to heart. I learned to do my best to be there for those who chose to share those stories with me. Look, I never thought my career will lead me to work at the White House, let alone to serve as the vaccinations coordinator for this country at this particular time in our history. But I always have those stories with me, and I'm always asking myself, what can I do to make sure that the Judys of Seattle will always have a warm place to sleep? How can I support the mom in Port Angeles so she can finally get a fair chance in a job market that has greater economic equity? What role can I play to make sure that kids in Wapato get healthy meals so hunger never gets in the way of homework? I hope we will all be bold enough to act, yet humble enough to ask for help. I hope we will all step up when we're needed and step aside when we're getting in the way. And I hope you will keep telling your stories to keep our momentum moving forward. So congratulations and thank you for inviting me to share this moment with you all today.
Thank you, Dr. Shuker, for your inspiring words. An important part of the medical school tradition is to commit to uphold the ethical standards of medicine in an oath on commencement day. Here at the Elson S. Floyd College of Medicine, we believe that those commitments began on the first day of medical school. So 4 years ago, our students read and accepted our student declaration that guided them during their medical education. Today, as these students now become doctors, we invite them to read the physician's oath as a pledge and commitment to continue upholding the ethical standards of medicine that they have been studying and practicing these past 4 years. Medical students, please join Dr. Jeff Haney in reading the physician's oath.
As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit consideration of age, disease, disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good medical practice. I will foster the honor and noble traditions of the medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is their due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honor.
Now the time has come to formally bestow degrees to the candidates who have fulfilled all requirements. Will the following candidates of the Elson S. Floyd College of Medicine please stand? If you are receiving your Doctor of Medicine, please stand. Those receiving your Masters of Science in Speech and Hearing Sciences, please stand. If you are receiving your Masters of Science in Coordinated Program in Dietetics, Nutrition, and Exercise Physiology, please stand. If you are receiving your Master of Science in Nutrition and Exercise Physiology, please stand. I now ask those students receiving their Bachelor of Arts in Speech and Hearing Sciences, please stand. And finally, those students receiving a Bachelor of Science in Nutrition and Exercise Physiology, please stand. President Schultz, I am pleased to present these candidates for advancement to the degrees as announced.
Upon recommendation of the faculty and by the authority of the Board of Regents and the statutes of the state of Washington, I hereby confer upon each of you who fulfills its requirements the degree for which you have been recommended with all its privileges and obligations. My congratulations to all of you.
Hello. I'd like to extend my congratulations to all of the graduates as well, and thank our fabulous speakers for their wonderful remarks today. It's really hard to believe that it's been 2,227 days since the Washington State Legislature passed legislation to allow the Elson S. Floyd College of Medicine to come into existence. That's 63,170,600 3-second moments in which all of us have had a chance to change someone's life. And think of all the firsts that have led to 1,000 other firsts. For our college, that's our first academic program, which was in speech and hearing sciences, our first PhD program in nutrition and exercise physiology, and our first medical education program for which our inaugural students are graduating today. As I was thinking about what I could say that I would be uniquely qualified to share, I thought of the following. Here are 5 principles to help you build a successful medical school. Now bear with me. I think I can make this relevant. Number 1, things don't always go as planned. It's been a rare day in the College of Medicine that things have gone exactly as we've expected it. But that's what's made it so challenging and yet so fun. Number 2, relationships are key. We've had hundreds of partners across the state, both big and small, that have allowed us to help train our students and extend our mission. Without them, we simply wouldn't be here. Number 3, develop a goal or vision that people can believe in. The best ones are bold and audacious. Number 4, culture. The best cultures are based on principles and values. Integrity, diversity, inclusion, belonging are great ones to start with. And number 5, remember the priorities. Number 1, take care of your personal health. Number 2, take care of the health of your family and friends and loved ones. And number 3, build a successful medical school. So there you have it, 5 tips to help you build a successful medical school. And as I'm thinking about it, I think these are 5 things that can help you be amazing healthcare practitioners to your future patients. You know, patients don't always do things as planned. They haven't seemed to read the same textbooks we did, or they don't follow our advice exactly as we give it. As many of you know, I'm a psychiatrist, and I once had a patient who had terrible delusions of being followed by the FBI. We were about ready to start antipsychotic medications on this person when lo and behold, yep, you guessed it, the FBI called me and said they were indeed following my patient. Patients don't always do things as planned, but that's what makes their care so challenging and yet so rewarding. 2, relationships are key, and the most important part of your relationship with your patient is trust. And here are 2 tips to help build trust with your patients. Number 1, never take shortcuts. And number 2, always work on your patient's behalf, not on your own. 3, build goals that your patients can believe in. The best way to do that is to listen carefully to your patients and ask them what their goals are. If they tell you their goal is to be healthy so they can take care of their grandchildren, then do everything in your power to make that happen. It's too easy to focus on the numbers sometimes, and what we need to do is focus on what our patients are telling us. 4, culture. Build a culture that your patients can feel comfortable and respected in. In order to build that trust, you need to create a sense of belonging. And 5, if you want to be the best practitioner you can be, you have to be at your best, which means you have to follow the priorities and take care of your personal health, take care of the ones you love, and then when you've done that, you can bring the best version of yourself so that your patients can receive the best care possible. Yoda said, "Do or do not, there is no try." So do your best. Make the most of those 3-second moments in which you can change your patients' lives. Relish the first time because they will lead to 1,000 other firsts. And when things don't always go as planned, remember you're human. Give yourself and your patients plenty of grace. May the force be with you always, and congratulations. On behalf of the Elson S. Floyd College of Medicine, congratulations to the graduates of our class of 2021, and congratulations to all who have contributed to their success. We have great hopes for all that you will do to serve the great state of Washington now and in the future. Thank you all for joining us. Have a great day, and go Cougs!